academic problem of children and adolescents. One thing we have to remember that school is the main social and educational venue for children and adolescents. So we will talk about first the academic problem. Academic underachievement or failure is a major health problem. Health public health concerns in youth affecting between 10% and 20% of youth, with long-ranging associations with high-risk behaviors and poorer adjustment in early childhood. The DSM-5 includes the category academic or educational problem uh, in the sections other conditions that may be a focus of clinical attention, since school failure requires clinical intervention and influences a child's level of overall functioning. An investigation of the effects of students' perception of support from parents, teachers, and peers showed a correlation with adolescent academic achievement. That is, adolescents' perception of support from their teachers and parents was related to their academic achievement, whereas perceived peer support was indirectly related to actual academic achievement. It continued to adolescents' overall perception of support, which was correlated to achievement. Academic difficulties and externalizing behavior problems have been found to coexist at higher rates than would be expected by chance. This association has been found in both clinical and epidemiological samples. A longitudinal study of academic underachievement and behavior problems in school-aged children from first grade to sixth grade found that the combination of academic and behavior problems in the first grade predicted continued academic difficulties and behavioral problems 5 years later. This combination was more frequently seen in boys than in girls, beginning with the first grade. This is also true for children with reading difficulties, attentional problems, and behavioral problems. Behavioral choices of life events can exacerbate academic problems in the absence of learning disorder and can interfere with lessening academic failures. For example, once a student perceives that he or she is failing behind academically, a greater temptation is to replace academic pursuits with other activities such as drug use. A recent study assessed the level of an deterioration in academic achievement in relation to the initiation of marijuana use among young teens. In a sample of rural teens, 36% of boys and 23% of girls initiated use of marijuana by the end of 9th grade, and that deteriorating academic performance was a significant predictor of initiating marijuana use. The hypothesis remaining to be tested is whether timely intervention to improve academic standing would lower risks of learning drug use. The DSM-5 academic and educational problem category is used when a child or adolescent is having significant academic difficulties that are not caused by a specific learning disorder or communication disorder or directly related to a psychiatric disorder. Nevertheless, intervention is necessary because the child or adolescent in school is significantly impaired, and this has an impact on the well-being of the child and may negatively influence concurrent psychiatric disorder. Now we will talk about the etiology or the causes of academic problem of children and adolescents. Many risk factors may play a role in academic underachievement or failure, including genetic factors, developmental factors such as premature birth, as well as environmental factors such as level of maternal education. Very preterm children exhibit difficulties in working memory, which is a crucial ability and skill in learning new information and developing academic skills. Children and adolescents troubled by social isolation, identity issues, or extreme shyness may withdraw from full participation in academic activities. Academic problems may be the result of a confluence of multiple contributing factors and may occur in adolescents who are previously high academic achievers. School is the main social and educational value for children and adolescents. I repeat, school is the main social venue and main educational venue for children and adolescents. Success and acceptance in the school setting depend on children's physical, cognitive, social, and emotional adjustment. Children and adolescents' competency in general, coping with developmental tasks are reflected in their academic and social success in school. Anxiety can play a major role in interfering with children's academic performance. Anxiety can hamper their ability to perform well on tests, to speak in public, and to ask questions when they do not understand something. Depressed youth also may withdraw from academic pursuits. They require specific interventions to improve their academic performance and to treat their depression. Youth consumed by family problems such as financial troubles, merit discord in their parents, and mental illness in family members may be distracted and unable to attend to academic tasks. Cultural and economic backgrounds. Cultural and economic background can play a role in how well accepted a child feels in school and can affect the child's academic achievement. Familial socio-economic level, parental education, race, religion, and family functioning can influence a child's sense of fitting in and can affect preparation to meet school demands. Last, cultural and economic background can play a major role in how well accepted a child feels in school and can affect the child's academic achievement. Familial, socio-economic level, parental education, race, religion, and family functioning can influence a child's sense of fitting in and can affect preparation to meet school demands. Schools, teachers, and clinicians about can share insights about how to foster productive and cooperative environments for all students in a classroom. Teachers' expectations about their students' performance influence these performances. Teachers serve as agents whose varying expectations can shape the differential development of students' skills and abilities. Such conditioning or such conditioning early in school, especially when negative, can disturb academic performance. A teacher's effective response to a child, therefore, can prompt the appearance of an academic problem. Most important is a teacher's humane approach to students at all levels of education, including medical school. Lastly, I would like to tell you that for adolescent and children, school is the main social and educational value for children and adolescents. অর্থাৎ স্কুল হলো শিশু এবং কিশোরদের প্রথম সবচেয়ে প্রধান সামাজিক এবং শিক্ষা কেন্দ্র হলো স্কুল। এই জন্য বলছি আজকে এই ভিডিওটা করার উদ্দেশ্য হলো যে ছেলেমেয়েরা স্কুলে যেতে চায় না, স্কুলে অনুপস্থিত থাকে, তো এটা কোনো সমস্যার সমাধান নয়। অবশ্যই আমাদেরকে স্কুলে রেগুলার উপস্থিত থাকতে হবে এবং রেগুলার উপস্থিত থাকলে টিচারদের সাথে কোঅপারেশন তৈরি হলে, ছাত্রদের সাথে কোঅপারেশন তৈরি হলে তখন সেটা একটা ভালো সমাধানে আসবে। কেউ যদি একাডেমিক প্রবলেমে ভোগে তাহলে তাদেরকে টিচারের সাথে, তাদের পিয়ার ক্লাসমেটদের সাথে শেয়ার করা এবং ফ্যামিলি প্রবলেমগুলো শেয়ার করা, এগুলো শেয়ার করলেও আমরা আশা রাখি ছাত্রছাত্রীদের এই একাডেমিক প্রবলেমগুলো সেভ হবে। তাহলে লাস্ট একই কথা, স্কুল ইজ দ্য মেইন সোশ্যাল অ্যান্ড এডুকেশনাল, আমি পড়ে শোনাচ্ছি এই যে এখানে, স্কুল ইজ দ্য মেইন সোশ্যাল অ্যান্ড এডুকেশনাল ভেন্যু ফর চিলড্রেন অ্যান্ড অ্যাডোলেসেন্টস। অর্থাৎ কিশোর কিশোরীদের জন্য স্কুল হলো সবচেয়ে বড় সামাজিক প্রতিষ্ঠান, সামাজিক জায়গা এবং শিক্ষার সবচেয়ে বড় জায়গা হলো স্কুল। অতএব স্কুল যাওয়ার কোনো বিকল্প নাই। যে সকল ছাত্রছাত্রী স্কুল যেতে চায় না, শুধু বাসায় পড়ে, তাদের উদ্দেশ্যে এই ভিডিওটা তৈরি করা যে অবশ্যই স্কুলে যেতে হবে। স্কুলে গেলে শুধু লেখাপড়া না, লেখাপড়ার বাইরেও আরও অনেক থিম আছে, অনেক কিছু আছে, সেটা আমাদের শেখার জন্য স্কুলটা খুবই জরুরি। তা সবাই ভালো থাকবেন, সবাইকে ধন্যবাদ জানিয়ে আজকের ভিডিওটি এখানে শেষ করছি। বাই বাই।